What factors can lead to a false negative TB diagnosis? Have you ever wondered why someone might test negative for tuberculosis even when they are infected? A false negative tuberculosis diagnosis happens when a person infected with Mycobacterium tuberculosis receives a negative result on diagnostic tests. This can delay treatment and increase the risk of spreading the disease. Several factors contribute to these false negative results, and understanding them is crucial. One major factor is immunosuppression. This occurs when the immune system is weakened, which can happen due to conditions like HIV infection, malnutrition, or chronic illnesses. When the immune system is compromised, it may not respond adequately to tests like the tuberculin skin test, leading to a false negative result. Additionally, if someone has recently received a live virus vaccination or has a concurrent viral infection, their immune response might be temporarily suppressed for weeks. This can further increase the risk of false negative results. Timing is also essential when it comes to testing. The tuberculin skin test usually converts from negative to positive about 3 to 4 weeks after exposure to the bacteria. If testing occurs too soon after exposure, the immune system may not have developed a sufficient response yet, resulting in a false negative. There are also technical limitations with diagnostic tests. For instance, molecular tests that detect rifampicin resistance can yield false negative results due to technical issues like a low bacterial load or mutations not detected by the test. Radiographic examinations may miss TB in its early or latent stages since visible lesions may not yet be present. Host factors play a role too. Malnutrition and a declining body mass index can increase the risk of TB and affect how well the immune system responds to tests. Chronic illnesses, such as chronic renal insufficiency, can impair immune responses and complicate the diagnosis. Clinicians must be aware of these factors to interpret TB test results accurately, especially in high-risk groups like immunocompromised patients or those with chronic illnesses. It's often recommended to repeat testing after the appropriate window period and to use multiple diagnostic methods to improve accuracy. In cases where there is a strong clinical suspicion of TB, further investigation or even empirical treatment may be necessary. In summary, false negative TB diagnoses can stem from immune suppression, early testing, technical limitations, and host factors. Recognizing these factors is vital for effective TB detection and management. Always consult a healthcare professional for personalized advice and testing.